I'm Emiley Schnieder, and I interned at the Phillips County Health Systems this past summer, and it was a lot of fun and very exciting. So out of all the departments, I was here mostly all day, every day, well, kind of, but most of my summer was spent in that department, and I was able to witness a lot of different x-rays, such as mammography. I actually got to see a cataract ultrasound, EKGs, x-rays, MRIs, CTs, and hip and back injections, which is kind of crazy to me because I never realized how much surgery and radiology interact with each other. So that surprised me. In the rehab department, I got to witness a lot of occupational therapy, which was very interesting to me, and along with physical therapy and wound care, which kind of made me a little squeamish because as they were kind of cleaning it up, the wounds, it was kind of creepy, but it was actually really interesting on how they bandaged it back up and everything. And then in the clinic, this was in the outpatient part. No, it wasn't. It was, yeah, it was. No, it wasn't. It was with the doctors, and in this part, I got to observe a lot of the nursing staff. I got to follow Jennifer Hammonds for the morning, which I was only there for like a day, and it was a morning, it was just till the afternoon, and I got to see how she interacted with all the patients, which you never realize how much they get to know each other, the patient and the doctor, until you actually follow them for a day, and she could just talk to every patient like they were a friend, and it was just kind of cool. And I learned how to make a patient feel comfortable in the office and observed patients' file before interacting with them and kind of getting to learn about what was wrong with them and why they were there. And then in surgery, which was kind of a bummer, the day I was actually scheduled for there were no surgeries going on, which was kind of not fun, but I was also able to go there a couple days with radiology for those back and hip injections or whatever they needed them for. And then on that day I was there, I got to see a lot of pre-op because the day after was when Dr. Nielsen was coming, and it was going to be a crazy day for them because they had many carpal tunnel surgeries they had to get done, so that was pretty cool, which I actually got to go in there with Jill. I was supposed to be in radiology that day, but they allowed me to go and watch what happened that day after. And then in outpatient clinic, I assisted the nursing staff and kind of just watched what they did, took vitals, took weight, and kind of watched how they interacted with the patient before the doctor came in. And then I got to follow an orthopedic doctor, which was Dr. Nielsen, and I watched his nurses kind of just go around with the patients, figure out what was wrong, what they needed Dr. Nielsen to look at. So that was pretty interesting. And then I got to follow a kidney doctor as well, like Ty did, which, like the coffee filter is what I got, but I couldn't explain it either. It was interesting though. And then leadership day was a fun day. I really enjoyed it and took a lot out of it. I actually took a couple leadership classes out of Fort Hays State University, so I also kind of had that under my belt buckle. And then during this day, we participated in a lot of activities to learn the importance of teamwork, which I also learned in the hospital setting with how much they all have to cooperate together to make sure the patient's up and feeling better. And thank you so much for this opportunity, Phillips County Health Systems and Nex-Gen.